Welcome to this CPD training on understanding social, emotional and mental health needs and managing behaviour in UK schools. This course is designed for support staff working across a range of educational settings and focuses on practical, professional approaches you can apply immediately in your role. This course is designed to support school staff in developing a clearer understanding of social, emotional and mental health needs, often referred to as SEMH. It explores how behavior can be managed in a way that is consistent, trauma-informed, and aligned with safeguarding expectations. Throughout the course, the focus is on practical strategies, maintaining professional boundaries, and encouraging reflective practice within UK school settings. This course is structured in 3 clear stages. First, it builds a strong understanding of SEMH and behavior within the context of UK schools. It then focuses on responding to behavior in a consistent and trauma-informed way, using practical strategies that staff can apply day to day. Finally, the course brings learning together through real-life case studies and a clear focus on safeguarding awareness. By the end of this course, participants will understand what SEMH means in UK schools and how it may present in pupils. You will be able to recognize behavior as communication, apply practical strategies to manage behavior safely, and understand safeguarding responsibilities and professional boundaries. SEMH stands for Social, Emotional and Mental Health. In the UK, SEMH is recognized as an area of special educational need and refers to how pupils experience emotions, manage behavior and form relationships. Behavior is the outward action we observe, but it is often linked to an unmet need. Rather than asking what's wrong with this child, a more helpful question is, what might this child be struggling to express? SEMH needs can present in different ways. Some pupils may externalize their feelings through aggression, while others internalize them through anxiety, withdrawal, or disengagement. Behavior rarely occurs without context. Understanding potential root causes helps staff respond with empathy, while still maintaining clear boundaries and expectations. Trauma and adverse childhood experiences can affect how pupils regulate emotions and respond to stress. Some behaviors may be linked to a pupil's nervous system being in a heightened state of alert. Pupils with attachment difficulties may struggle to trust adults or manage relationships. This can lead to behaviors that appear controlling, oppositional, or inconsistent. Neurodivergent pupils may experience the school environment differently. Sensory overload, changes in routine, or communication challenges can all contribute to behaviors that staff need to interpret carefully. Sometimes behavior is triggered by the environment rather than the pupil. Noise levels, unclear instructions, or inconsistent adult responses can increase stress and lead to escalation. Behavior is a form of communication. When pupils lack the skills or language to express emotions, behavior can become their way of being heard. Punishment on its own rarely changes behavior long term. Without addressing underlying needs, behavior is likely to repeat, and relationships may be damaged. Positive relationships are one of the most effective tools in behavior support. Pupils are more likely to regulate emotions when they feel safe, understood, and consistently supported. De-escalation starts with the adult. Staying calm, using clear language, and reducing demands can help prevent situations from escalating further. Emotion coaching helps pupils recognize and understand their feelings. Validating emotions does not mean accepting unsafe behavior, but it does support learning and regulation. Pupils with SEMH needs benefit from predictable routines and clear boundaries. Consistency across staff reduces anxiety and builds trust. The language adults use can either calm or escalate a situation. Avoid labels or confrontational language and focus on clear, respectful communication. Not all behavior requires the same response. Staff must recognize when behavior moves from low-level disruption to a situation requiring immediate support or safeguarding action. We'll now look at a series of case studies to help apply this learning to real situations commonly seen in UK schools. A Year 3 pupil frequently has emotional outbursts when moving between activities, including crying and shouting. What the behavior may communicate could be anxiety about change, difficulty regulating emotions. Now, the appropriate responses would be to provide warnings before transitions, use calm reassurance and visual supports. It is essential not to rush the pupil and use public reprimands. A Year 9 pupil becomes verbally aggressive when challenged by staff and may leave the lesson without permission. This behavior may communicate a fear of failure or a loss of control. Appropriate responses include staying calm, speaking privately once the pupil has settled, and setting clear boundaries with support. It is important to avoid power struggles and public confrontation, as these can escalate the situation. A pupil avoids tasks, sits quietly, and refuses to participate in learning activities. This behavior may communicate low self-esteem, anxiety, or underlying emotional distress. Appropriate responses include offering gentle encouragement and taking time to build trust gradually. It is important not to assume laziness or ignore concerns, as this may prevent pupils from receiving the support they need. Some behaviors may raise safeguarding concerns, and staff should follow school procedures by sharing these with the designated safeguarding lead. The designated safeguarding lead is responsible for overseeing safeguarding concerns and supporting staff by advising on appropriate next steps in line with school policy. Maintaining professional boundaries helps protect both staff and pupils, while ensuring safe and appropriate working relationships. Self-regulation and reflective practice are essential when supporting pupils who present with challenging behavior. Understanding behavior through an SEMH lens helps staff respond both professionally and compassionately, while still maintaining clear expectations. Behavior always has meaning, relationships matter, and consistency plays a key role in supporting pupils effectively. Thank you for completing this CPD training, and remember that reflective, consistent practice makes a real difference for pupils with SEMH needs. You have now completed the training. Please proceed to the assessment questions to demonstrate your understanding of the course content. All questions must be answered correctly to pass, and you may revisit the training if needed. Once completed, your certificate will be emailed to you and saved in your candidate portal.